master's class called Understanding Rosacea and Curating a Healthy Treatment Plan. This is Carla Keene. I'm CEO and developer of ClarityRx. I want to thank you for joining us today. Let's talk about just the facts about rosacea and why it's such an important topic for us estheticians to understand. It affects an estimated 16 million Americans every year. 3 million more are diagnosed cases per year. Rosacea is a very chronic and potentially life-disrupting disorder, primarily found in the facial skin and often characterized by flare-ups and remissions of those flare-ups. Many have observed that it typically begins anytime after the age of 30 as redness on the cheeks or flushing, and then to the nose, chin, or forehead, which may come and go. In some cases, rosacea may also occur on the neck, chest, scalp, or the tips of the ears. Over time, the redness tends to become ruddier and more persistent, and visible blood vessels like telangiectasia may appear in clusters. Left untreated, these bumps or pimples can often develop as well, and in severe cases, the nose may grow swollen and bumpy from the growth of excess tissue. On this graph, we can see the different ages and genders that are affected by rosacea. You can see the onset of rosacea can begin as early as 2, 3, 6, 14, where it really crescendos between the ages of 19 and 40, and can even get more progressive in our elderly years. We can see by the graph below that it affects females a little bit more than it would males. In addition, although rosacea can affect all segments of the population, individuals with fair skin who tend to flush or blush easier are believed to be at greater risk. The disease is more frequently diagnosed in women, but more severe symptoms tend to be seen in men. While there is no cure for rosacea and the cause is really unknown, medical therapy and skincare options are available to control its signs and symptoms. Individuals who suspect that they may have rosacea should be urged to see a dermatologist or another knowledgeable physician for a diagnosis and appropriate treatment if needed. Remember, because it is a medical condition, it's considered outside of our scope of practice. What can estheticians do? We can improve the appearance of the conditions associated with rosacea and maintain that effect through services and products that we offer. So what do we really look for with rosacea? It can be substantially different from one individual to another. According to a consensus committee and review panel of over 17 medical experts worldwide, rosacea always includes at least one of the following primary signs, and various secondary signs and symptoms may also develop. First and foremost, flushing. Many people with rosacea have a history of frequent blushing or flushing. This facial redness may come and go and is often as the earliest sign of the disorder. It then becomes more of a persistent redness. Persistent facial redness is the most common individual sign of rosacea and may resemble a blush or a sunburn that just doesn't ever go away. The next is bumps and pimples associated with that persistent redness. These are small, red, solid bumps, sometimes can be pus-filled pimples. They can develop around the nose, the sides of the nose, amongst the cheeks and chin first. While these may resemble acne, blackheads are typically absent, and more importantly, burning and stinging may occur, which separates it from a normal acne condition. We also see visible signs of blood vessels or clusters, again known as telangiectasia. These are a mask of redness, often associated with rosacea, visibly on the skin, more importantly, visibly across the nose and on each side of the nose amongst the cheek area. Other potential signs and symptoms of rosacea include eye irritation. Although rare, in many people with rosacea, the eyes can sometimes become irritated or appear watery or bloodshot. This is a condition known as ocular rosacea. The eyelids become red and swollen. Sometimes they even start to flake a little bit. And in severe cases, it can result in corneal damage or even vision loss without medical help. Burning and stinging is a very common side effect of these other conditions associated with rosacea, and it may occur on the face, itching or feeling tightness. This is where we can really help these clients by hyperhydrating their skin. Also, extremely dry appearance to the skin where it actually can seem to be rough, it can flake, or appear to be very dry. We sometimes even see plaques, which are raised red patches known as plaques. They can develop without changes in the surrounding skin. So a lot of times they're a very defined patch with a very distinct line of demarcation. Also, some cases we see thickening of the skin. Primarily, this condition is known as rhinophyma, is more effective in men than women, but this is when we see an enlargement or thickening from excess tissue commonly seen on the nose. And then last but not least, in some severe cases, we see facial swelling or edema, and it may accompany other signs of rosacea or can occur independently. Signs beyond the face, again, can also develop on the chest, neck, scalp, and the tips of the ears. Here we see the different subtypes of rosacea. In my opinion, within the scope of aesthetics, we can manage or improve the appearance of these conditions. Absolutely in subtype 1, where we see lots of facial redness and flushing. Keep in mind when you see this sort of irritation or inflammation or edema in the skin or erythema, we want to sedate that skin and avoid anything of stimulating. Subtype 2 is this facial redness along with some flushing and bumps and pimples start to develop. We start to see more clusters of these distended capillaries. Subtype 3 is skin thickening. So we see here again on the bulbous of the nose, sides of the cheeks, getting some thickening of the tissue, and it really changes in appearance. And then last but not least is subtype 4. This is your ocular rosacea, typically associated with very watery or bloodshot eyes, and also associated with some burning and stinging. So these, in essence, are in order, subtype 1 through subtype 4, the different types of rosacea that we will see within our practice. I'm comfortable saying that I get great results with subtype 1. Anything more advanced in subtype 1, in instance of subtypes 2, 3, and 4, I make sure my clients understand the importance of seeing a physician. Remember that many patients experience characteristics of sometimes more than one subtype at a time, and often they develop in succession. So typically it starts out with subtype 1, can elevate into subtype 2, if left untreated, can then elevate to subtype 3, and then in severe cases, we see the subtype 4. Okay, so how is rosacea really treated? Again, I think we have to keep in mind that as estheticians, this is normally outside our scope of practice, so we can't use the word treat. However, managing the conditions associated with rosacea is really the language that we need to approach our clients with. Because the signs and symptoms of rosacea vary from one client to another, treatment can also vary and must be tailored by a physician and or an esthetician for each individual case. There are various oral and topical medications prescribed by physicians, and often initial treatment with oral and topical therapy can bring the condition under immediate control. And then that's really where we come in, where we can be followed in by long-term use of services and products to maintain the remission. A version of an oral therapy with less risk of microbial resistance has also been developed specifically for rosacea and has been shown to be safe for long-term use. And so this would be a prescribed oral topical therapy for physician dispensing. When appropriate, treatments and products are promising and can reduce redness and inflammation. Oral or ocular rosacea, may be treated by a physician with oral antibiotics and other therapies. What are some of the causes of rosacea? Although exact cause is unknown, various theories about the disorder's origin have evolved over the years. It's really gotten pretty interesting, actually. Facial blood vessels dilate really easily, and increased blood near the surface of the skin makes the skin appear red and flushed. What causes these things? There are some known factors. Acne-like bumps appear often in the redder areas of the central face. This can be due to factors related to blood flow. Bacteria has even been considered. Microscopic skin mites, irritation of the follicles, sun damage of the connective tissue under the sun from UV exposure, and abnormal immune or inflammatory responses, and sometimes even psychological factors such as stress can occur. None of these possibilities have yet to be proven, although potential inflammatory pathways have been identified in recent ongoing research, including an immune response triggered by a type of antimicrobial protein known as cathelicidin. Is rosacea hereditary? Although no scientifically research has been performed on rosacea and heredity, there is evidence that suggests rosacea may be inherited. Nearly 40% of all rosacea patients surveyed by the National Rosacea Society said they could name a relative who had similar symptoms. In addition, there are strong signs that ethnicity is also a factor in one's potential to develop rosacea. In a separate survey by the Rosacea Society, 33% of the respondents reported having at least one parent of Irish heritage, and 26% had a parent of English descent. Other ethnic groups are elevated rates of rosacea compared with the U.S. population as a whole, included individuals from Scandinavia, Scotland, Welsh, or even Eastern European descents. How long does rosacea last? Well, unfortunately, it's a very chronic disorder. Rather than a short-term condition, it is often characterized by relapses and remissions. A retrospective study of 48 previously diagnosed patients with rosacea found that 52% still had active rosacea, with an average ongoing duration of 13 years. Hence, I believe why it's important that we find a more natural, healthy solution for these clients, seeing that they can't be on some of these most harsh types of oral or topical medications prescribed by physicians. The remaining 48% of that studied population had cleared, and the average duration of the rosacea had been 9 years. While at present there is no cure for rosacea, but its symptoms can be usually controlled with treatment and a lot of lifestyle modifications. Moreover, studies have shown that rosacea patients who continue therapy for long term are less likely to experience a reoccurrence of the symptoms. This is why it's important to talk to our clients about the long-term skin wellness program that we can have them on both in service and in home care regimens to maintain or manage the symptoms associated with rosacea. Here are some rosacea triggers. In addition to medical therapy, rosacea patients can improve the chances of remission by identifying and avoiding lifestyle and environmental factors that trigger flare-ups or can aggravate their individual conditions. Identifying these factors is an individual process, however, because what causes a flare-up for one person may not have any effect on another. On the next slide, I'm going to talk about rosacea triggers that can and variously affect some individuals. The first was compiled from patient histories, and the second list results from a patient survey by the National Rosacea Society. By the way, if you haven't already gone to the website, the National Rosacea Society's website is loaded with information that we can pass on to our clients who suffer from this chronic disease. Neither list necessarily includes everything that may cause a flare-up, but this may be helpful in determining one's own trigger factors. The things on the National Rosacea Society list include keeping a diary of the daily activities or events that can relate them to any flare-up so they can document what to stay away from. Also, the following list compiled from patient histories by Dr. Jonathan Wilkin and produced by the National Rosacea Society are the following, some of which you wouldn't suspect. Some of the foods include liver, yogurt, sour cream, cheese, chocolate, vanilla, soy sauce, even vinegar, eggplant, avocados, and spinach, sometimes broadleaf beans and bean pods. Some citrus fruits, including tomatoes, bananas even, red plums, raisins, or figs have been determined. We think and know that spicy and thermally hot foods can contribute as well, and any foods high in histamines. So here's a snapshot of some of the things in a lifestyle choice our clients can do to subdue some of the conditions associated with rosacea. In addition, any temperature-related things such as saunas, hot baths, just overheating, excessively over exercising, and very warm environments can trigger or accentuate the conditions associated with rosacea. Also, weather or environmental factors such as UV exposure with the sun, strong winds, cold weather, humidity or lack of humidity in the air. Also, topical drugs, any steroids or known as vasodilators, such as heart medications, things like that can also begin an onset or create a more severe condition. Emotional factors such as stress and anxiety can also contribute. Some beverages that we intake, like alcohol, especially red wine, beer, bourbon, gin, vodka, and champagne, sounds like all the fun ones, can also accentuate the conditions associated with rosacea. And hot drinks, of course. So that includes ciders, chocolates, teas, coffees, things like that. One of the things I've noticed with my rosacea clients is that the stress and anxiety is real. If they have a lot of stress in their life, it tends to really flare the rosacea. One of the things I do like to talk about is that because we see fluctuation with the conditions associated with rosacea, we may also have to alter the regimens in which they use at home and how progressively we have them on those regimens. So let's talk about that for a moment, the proper skincare and cosmetics that we need. Clearly, any consistency matters so that when we write journals or have our clients write journals on the ebbs and flows of the rosacea condition, we can see what's really working. Give it a chance. In fact, gentle skincare and effective use of the right makeup can make a visible difference in managing our clients' rosacea and improving the look of their skin. Now, one of the things that I encourage my clients to stay away from is a very heavy oil or wax-laden foundation. To me, this seems to keep the skin, like the heat trapped in the skin. It doesn't allow the skin to function normally when we have something very occlusive on the top, and it just doesn't do our rosacea clients any favors. I always recommend a light dusting of a mineral makeup, staying away from the fluid makeups, just to give the skin a little bit of even out in the color and tone, but not to use anything occlusive. The key is to use products and techniques that minimize irritation. So again, here we are working on a skin type that's pretty stimulated. The last thing we want to do is encourage more vasodilation or stimulation by using products that are stimulating, such as your low pH acids, your aggressive retinoids, anything that elicits heat. One good guide is to look for products that are noted for rosacea. These have hopefully been tested and proven safe on conditions associated with rosacea. But stay away from anything that could cause any stinging, burning, or irritation. The National Rosacea Society surveyed over 1,000 patients, and 41% said that certain skincare products can aggravate their condition, and 27% said certain cosmetics also cause rosacea flare-ups. Now, the Rosacea Society firmly believes that there are triggers within our products and services that do that, such as fragrances, high levels of parabens, some colorants. So it's not just the performing ingredients like retinols and acids, but some of the ancillary or non-performing ingredients found in our service products and home care products that can aggravate these conditions. So again, look for a very clean, healthy ingredient deck for the clients that suffer from rosacea. To avoid irritation, follow these tips when choosing the right skincare and makeup. Watch again for irritants. We know that the National Rosacea Society cited the following ingredients as triggers for irritation. So clearly alcohol, a 30% witch hazel, lots of fragrances, over 30% in fragrances, 21% to menthol, 14% of patients in this survey responded to peppermint and eucalyptus oil. So again, these are kind of triggers as ingredients within a product formula. Most respondents said they avoided astringents, exfoliating agents, and other types of products that are too harsh or sensitive. Now, I love the Senzyme Duo from ClarityRx for rosacea clients because it's just a very mild, decongestive exfoliant without using any harsh abrasives. In fact, it actually kind of diffuses the redness. Always choose fragrance-free, and I should say synthetic fragrance-free skincare and makeup products. According to the American Academy of Dermatology, fragrances cause more allergic contact dermatitis than any other ingredient. Pretty important stuff there. Skin is a vast portal for allergens, and irritation allergies can weaken skin even more. So using fragrance-free or allergy-tested products can really reduce the risk of skin irritation. Note that when a company says allergy testing or allergy tested, don't be confused with hypoallergenic, a term that is not really clearly defined by the cosmetics industry. Test a product first before using it all over, maybe a patch test to see if there is a response immediately. If you have a reaction, avoid the product and note the ingredients so we don't recommend it again or use it in treatment. Rosacea irritants may vary from person to person, so an individual skin reaction should be your guide, not an overall blanket or broad brush approach. Using minimal products, keeping things simple, both in service and in home care, because if things do arise, you want to go through the process of elimination to find out what's working and what's not. Some of the recommended home care heroes from ClarityRx for conditions associated with rosacea are: take it easy. Clearly, this is our calming serum. We have been coined the really Visine for the skin. It has the ability through 2 natural ingredients to just take the redness out. Take your vitamins or colloidal mineral spray, amazing to subdue inflammation, redness, and erythema, and to reduce heat in the tissue. On the mend, this is a great cooling, mending gel, just terrific if your clients don't have any known allergies to the natural extracts in that. Make sure you use a fan with On the Mend to get that extreme cooling effect, both in treatment and for recommendation application for home care. Obviously, the daily dose of water, because keeping the skin hydrated is a key necessity to balancing the skin so that the skin can stay and function normally, and create the balancing can also help minimize the effects of rosacea. Nourish your skin, also locking in the skin's natural moisture and giving the skin the softness that it needs to avoid that excessive dryness that we sometimes see. So there you're applying both the oil and water to create the balance in the skin with those 2 products. Calming the morning is amazing also because of the high levels of ageline, which is the oil pressed from the chamomile flower that has very strong anti-inflammatory properties to it. The cold compress mask, again, just amazing at instantly cooling and compressing. I love to have my rosacea clients keep this in the refrigerator. I also keep the one for treatment in the refrigerator at the spa, and this just goes on very cool and soothing to the skin. And a very cool towel over the top of this, or the Infusa pop-up mask in treatment, is very good. The Rise and Shine is very good at medicating the ruddiness or the redness. So if you've got a client that has a pretty incessive outbreak or inflammation around the cheeks and nose, I love this product. It's a titanium dioxide that is a really strong anti-inflammatory and can help reflect some of the redness. Some of the recommended services, I love the Sensitive Skin Facial, the ClarityRx Sensitive Skin Facial protocol for this. This is found in your protocol manual. The blue LED is amazing for this as an upgrade to the Sensitive Skin Facial, or as a series of just blue LED skin phototherapy treatments. I also love the ClarityRx Hydrating Facial with Cold Stones. And therefore, I love to include all of these as part of a treatment plan. And so we're getting the skin a little bit of everything that we know within the toolbox that we have to mitigate some of the redness and irritation that they see or feel with rosacea. Stay away from stimulation or overstimulating both in treatment and in home care. So this means no heat, no steam, no hot towels. It also means no progressive abrasion, so microdermabrasion and no vacuum because of the microdermabrasion that has a vacuum. I tend to stay away from micro altogether. I tend to stay away from peels as well, even though a light flushing or light brushing, I should say, of the salicylic can sometimes create that anti-inflammatory reaction. It's a fine line because it can also progressively irritate. So do a little patch test to see. I would stay away from the uber sensitive skin types with the peels as well. So again, no stimulation. We want to choose all the things that we know that will sedate, cool, and calming and soothing and cold. All of that is the direction that you want to go in. Thank you so much for joining us again today. If you haven't already followed us on social media, we do lots of educational posts on there. If you have any questions regarding anything discussed in this master's class, don't hesitate to reach out to our education department at education@clarityclinicalskincare.com. You can also contact our office by phone at any time at the number listed below. Thanks again, and have a great afternoon. Bye-bye.